Before we set out in the morning, we were pretty much aware that some locals have contracted the disease. We were aware of a place in Kigoma near the beach side of the Lake Tanganyika, and then another episode here in Mvunzi. So we went to look, first of all, to see verify the occurrences of these cases. But the most important challenge was to confirm or refute that transmission is occurring locally. So having been around today, we have looked at the two places, reviewed data with the help of the local health facilities and staff. We have seen their papers, and then we have also come this far, Mvunzi, to look at their documents and visit the patients and have information from them to help us take decisions.
Can we see if the mother's name or something like this?
Having visited both places, first of all, we were convinced ourselves that these two areas had transmission. And there were sporadic cases. There were 3 cases in Kigoma, and here in Mvunzi there have been more than 8 or 9 cases, and some had been severe enough for them to report to the local clinic for treatment. But currently, in both instances, we do not see an environment of well-established transmission. We foresee that possibly these 2 isolated cases would run or burn themselves out of small clustered outbreaks that will kind of spend themselves out because they did not have the opportunity to affect other people or the environment such that the transmission could be propagated or continuously affecting other people. But we are on the kind of caution because somehow it starts like that, and after a week you get a bigger bloom of unwanted transmission, and that could be very, very dangerous for the small communities and even the bigger community in Kigoma. We have talked very in depth with one of the cases who incidentally was one of the last cases and not at the beginning of this clustering of cases. But looking at the environment and the water sources and communication with movements that occur from Kigoma and among the asylum seekers population who also come this far, we have the feeling that this kind of spots of outbreaks could occur very much related to the bigger outbreak that is occurring in town Kigoma, related to the asylum seekers that are arriving and some having to pass through these areas down south over the lake. So possibly it is linked with influx of asylum seekers and who are coming from an area which is currently having declared an extensive outbreak. So we are trying to put in place precautionary measures, including strengthening the clinic here, improving supports and linkages with the clinic, and same as in Kigoma. Most crucial is getting the population to understand the challenges, carrying out social mobilization and health education to make sure that we don't miss if outbreak starts again or transmissions should start again, we don't miss the immediate opportunity to control it and provide support to the communities.